health and a little wealth and a lot of love.
So we talk about health and wealth in the show, so let's tie in a little bit of the financial aspects of this. So let's talk about insurance coverage. Like, how difficult is it for insurance to cover this? And let me hold my thoughts. Yeah, so how difficult?
You definitely have to meet certain parameters before they'll be even willing to cover for certain insurance companies. I think they know the long-term benefits of the weight loss associated with bariatric surgery and the improved outcomes with diabetes and all of these other medical conditions that I think more and more insurance companies are starting to cover. But you do have to jump through a lot of hoops, and typically you have to show that you're going through a six month, I think some of them will say a 6-month weight management plan where you're seeing a weight management specialist regularly, either on a weekly basis or at least on a monthly basis. I know I had patients that were seeing me even in primary care office who had to make sure that they were meeting those guidelines in order to be eligible, in order for insurance to eventually pay for their surgery.
Right.
And so there are a lot of hoops that you have to jump through.
Right. And I feel like there's a lot of upfront costs. And man, this is a whole debate online right now about obesity being a disease, right? And so I do think addiction is a disease of the mind. And I'm not saying all cases of obesity is going through that addiction process, but I do think that in some cases where, yes, it is, it's a comfort thing, it's emotional eating and things of that nature. And I do think that as we explore that a little bit, it's a challenge, because if you do want to get help and nothing else is working, and this is something that's been recommended, you do all the things right, and then insurance, I just feel like the insurance, like, it's going to cost more later, like if something happens or a complication, where I feel like, it's so challenging. Insurance it's challenging, right?
Yeah.
I do think there's some boundaries and parameters in place with insurance, but I think in some cases like this, it makes it hard for the patient.
Yeah, I think from a surgical perspective, it makes sense to me why insurances are a little bit more strict with guidelines. I think some of it is overkill, and some bariatric specialists will say they make people wait too long, that they should be offered, especially if they meet certain numbers,
Exactly. Yeah.
they should be offered this option from the beginning, because it'll help them lose the most weight, lose it, before they have the long-term issues, instead of making them wait 6 months or 12 months of doing doing just lifestyle interventions. I understand the point of that too, but I think it makes sense. What doesn't make sense to me so much is of insurance companies not covering medications that can help with weight loss, where you're not having the post-op risks.
Right.
I think that is what really irritates me, and what
Which I think we'll talk about that
grinds my gears.
Grinds your gears over here, Emily MD. Okay.
With a little health and a little wealth and a lot of love. That's the life that we live. Susan Scruggs.